Good morning. I'm going to talk about what we can expect if we implement some policies that could be expected to reduce sugar-sweetened beverage intake in children. See if I can get this to work. No. How about, there it goes. Thanks to my funders, our funders of our team. I think there's a bit of a delay here. Hit that. There it goes. I bet you the battery is getting low on this. I bet you that's what's going on. What we've done in our work is we've been interested in the consequences of sugary beverage consumption among children, and we've tried to estimate the impact of policies that could limit that consumption. We've tried to move beyond asking just what's effective and to also consider the cost of interventions and their likely impact on population health. And as part of that, we've examined over 40 different obesity programs and policies, and actually now about 50. We've conducted systematic evidence reviews of more than 130,000 peer-reviewed publications for evidence of effect. We've estimated the cost of these interventions following standard guidelines and projected the population impact of these interventions and their cost effectiveness over 10 years in the United States using a microsimulation model that we say uses big data. I'll tell you just a little bit about that in a minute. It's like a SimCity type model of a virtual population of 1 million people. We have a little model where we base it on U.S. Census data all over the country. I mean, that's why it becomes really big. We build in all the trends that we know throughout the United States in terms of BMI and changes in obesity across different states and cities. We build in the patterns over time of body growth and change. And then we project into the future what will happen if we don't do anything in terms of rates of obesity, consumption of sugary beverages, and then outcomes like obesity, healthcare cost, and mortality. And then we talk about a range of different interventions, and we model out their impact. And then we project what will happen into the future. A lot of this is based on the fact that it's not very hard to predict what your weight and height will be in the next 10 years. I mean, I can predict pretty well what the weight or the height of this group will be next year. It's kind of a joke. And the aggregate, what your weight will be next year. It's probably what it is now plus about, I don't know, half a pound this group, maybe a quarter pound. It's not hard to project. What we need to model out these interventions is we need effects of reach, or estimates of reach, estimates of effect, and estimates of cost. And I'll mention just a few of these. First of all, by sugar-sweetened beverages. We define them as soda, sports drinks, fruit drinks, and punches, sweetened tea. This is, you can see, here's Claire Wong's paper back in 2008. This is the definition we use. This does not include 100% fruit juice or flavored milk. I'm going to come back to fruit juice, though, because I think it's important. What about effect? Or, what did I jump over that? No, we've looked at 3 different interventions that are pretty relevant because they can reduce sugar-sweetened beverage intake. One is the sugar-sweetened beverage excise tax. This is like the 1 cent per ounce tax in Berkeley, California, San Francisco, and Albany, which just raises the price, and you actually see that on the item. It's not a sales tax. We've also looked at interventions that limit SSB intake in early care and education settings. I mean, the knapsack intervention does this. It does other things too. That's part of what it does. And then I have to mention school-based interventions. Even though we're focused on the 0 to 5 group, Smart Snacks will tend to eliminate sugary beverages and junk food in school settings. And you get some 5-year-olds there. It's an important regulation. When we think about the reach of interventions that can impact sugary beverage intake in kids, well, this is from the Wong paper back in 2008, but things haven't changed much. Like when we ask where do kids drink sugary beverages, sugar-sweetened beverages, it's mainly at home. and the home of other people's houses. Like my kids used to go next door because they could get sugary beverages next door. And in 2 to 5-year-old kids, it's mainly at home and next door, and a little bit in school settings. So if you want to make an impact, the biggest impact is going to be in homes and then within, say, these ECE settings. That's where you're going to make the major impact, but homes are big. What about the evidence for effect? I'm spending a little time on this because we've been kind of assuming that we have this effect of sugar-sweetened beverages on kids' relative weight and obesity, and I think the evidence is actually quite strong. The best study here is the Reuters study from the Netherlands, which is a double-blind randomized trial where kids are followed over 18 months. Kids didn't even know that they were consuming a sugary beverage or a non-caloric beverage. And these sorts of studies have also been, with this sort of relationship, has also been shown in other non-randomized studies, but change studies. I'll come back to this later just because I think it's so important. Most of the analyses done in this area are flawed because they look at a baseline predicting change, which is actually nonsensical. It makes no sense. And I'll come back to that and show you why that doesn't make any sense. But the randomized trials, particularly the Reuters study, shows very clear evidence of effect. You increase sugary beverage intake, you'll lead to excess weight gain. The evidence among children 0 to 5 years old is less robust. We don't really have randomized trials focused in this age group, although the Reuters study did include some kids in this age range. Part of the problem here is that there's lots of measurement problems. You know, if you have a child who's 0 to 5 and I ask you how much, sugary beverage did they consume yesterday or today, you'll know that it's pretty hard. You know, how much went in their mouth, how much went on the floor, what did they really consume? There's a lot of, and when you have a lot of measurement error, you'll tend to attenuate relationships. And again, a bunch of the studies done in this area mix change and change studies and baseline predicting change studies. And the baseline predicting change studies are nonsensical. They don't make any sense. I'll come back to that again later. The other thing that's really interesting, in the Reuters study, the double-blind randomized trial, you found much larger effects for children at higher BMIs. This was a secondary analysis of that data. This has been shown in adults too. It seems like if children are pretty lean, they'll recognize that they're not getting those calories and they'll tend to compensate. But kids who are at higher BMIs in the Reuters study didn't show that much compensation. And it's quite striking, though, that the higher BMI group in the Dutch study is the average for kids in the US. So the estimates of effect that we assume in our modeling are probably underestimates because they're just being conservative. So let's talk about these interventions where we've modeled out the impact of, let's say, a 1 cent per ounce excise tax if implemented in every state in the United States over the next 10 years. We'd save about more than 500,000 cases of childhood obesity, prevent those. And we'd have healthcare cost savings about $14.2 billion. So this is an intervention that saves much more in healthcare costs than it costs to implement. Smart snacks is another interesting one. It is a cost-saving intervention too. We project that it would prevent about 345,000 cases of childhood obesity and save about $792 million. Now, the knapsack intervention, again, it's an intervention that will change a number of aspects of diets of kids in early care and education settings. It has a much smaller reach. I mean, not that many kids are in early care and education settings. It will save about 38,000 or prevent about 38,000 cases of childhood obesity. And it actually costs money to implement. But I'll come back to that in a minute. There aren't that many cost-saving interventions out there, and we do have to invest in our young children. But knapsack is an interesting intervention. And for these interventions, we see that an SSB excise tax would save about $33 for every dollar invested. Smart Stacks about $5 for every dollar invested. And the knapsack would not return you much money on your investment. Actually, we've made other estimates for other states as they've implemented this, and it gets higher, maybe 8 cents out of a dollar. The other interesting thing about a sugary beverage excise tax, which would reduce consumption, you raise the price and people consume less, is it would tend to reduce disparities. Well, there's higher consumption of sugar-sweetened beverages in low-income and ethnic minority populations, and you will see a greater percentage reduction in childhood obesity if you implemented a tax like this. We did some recent estimates for the state of California, and in fact, you even get larger reductions in disparities because in California, there's been a big decline in consumption of sugary beverages among non-Hispanic white children. And so the disparities in consumption at baseline are larger. You also see some evidence for some reduction in disparities among kids at lower incomes, a greater effect on the percentage change. So if I can summarize some of the results, some of the interventions we've looked at, particularly sugary beverage excise tax and smart snacks, are projected to prevent future obesity and save more in healthcare costs than they cost to implement. And both of these interventions, I didn't walk through the estimates for smart snacks, but these are also strategies that can be expected to actually also improve health equity while they improve overall population health by reducing cases of childhood obesity. So again, even though it relates to kids who are school age, I just think it's an important policy moment in time to try and make sure that smart snacks is continued. Another policy implication, I think, is that states and cities should look carefully at the potential for an SSB excise tax to cost effectively improve population health, improve health equity, and also raise funds for other preventive activities. One thing I didn't point out in that slide where I was talking about the cost effectiveness of different strategies is that a sugary beverage excise tax, again of a penny an ounce, could be expected to raise about $14 billion per year in revenue that could be used for other preventive activities. And it's fascinating that I remember just a few years ago, people were saying, well, I mean, that's really unrealistic to think of these sugary beverage excise taxes, but now we have them in Berkeley, San Francisco, Oakland, Albany, Boulder, Cook County, Chicago, my hometown, Philadelphia, and Seattle. They've all passed sugary beverage excise taxes. The Seattle tax is actually $1.75 an ounce, and that will have a major impact on price. Now, the interesting thing about these, though, is that there's not a lot of work being done to study the impact on children. These are initiated. I think the Bloomberg Foundation has done some funding to study the impact on beverage purchases, which is great, on scanner data, and I think Philadelphia, Cook County, and Oakland. I don't think too much is being done to study the impact on children, though, and I think it's an opportunity. That's probably in the works, but that's just a point that I think is important. So again, some of these interventions we've looked at that are real interventions actually currently happening can be cost-saving. And I mentioned the work in the early care and education setting. As we've heard here, a lot of these habits and practices around sugary beverage consumption start really early. And as children are located in early care and education settings, there's this huge opportunity to provide much healthier environments. As I mentioned, a intervention like knapsack costs money. It'll tend to reduce rates of childhood obesity and improve the beverage consumption, but it does cost money. I mean, but it's interesting, though, as we've been costing out the implementation of knapsack in a number of different states, like we found a number of interesting things that, for example, if you have a child care center with, let's say, 30 children, and you just replace a 100% juice with water in that setting, it's, you can say, well, it's not going to make much of a difference in obesity. But at that setting level, it will probably save them $1,000 a year. And that in itself alone is something to make it a really interesting intervention for early care and education settings, particularly because everybody there is generally operating at basically fast food wages, very low income settings, and that can make a substantial difference. So now I'm going to mention a couple things. One is we have studied treatment strategies, and they show small effects. I won't go into that here, but the important point, and I think everything we've been talking about here, is that we can't expect to treat our way out of the childhood obesity epidemic. It generally produces too little, too late, and kind of too expensively. They're important for kids, but we really need to think about preventive strategies in all the different settings we've talked about. And one thing that we found is we've been working with folks in a bunch of different states, Washington, Oklahoma, Arkansas, Mississippi, West Virginia, and New Hampshire. We found really widespread bipartisan support for thinking about strategies within these settings that are cost effective, best value for money strategies. Let's get back to talking about 100% juice. Thus far, we've been talking about sugar-sweetened beverages as the problem, and we haven't really talked about 100% juice as part of the problem. It's been really interesting. If you look at the data in adults, change and change studies in adults, I think probably the best done study, based on more than, I think, about 120,000 120,000 individuals followed over, 20 years, is the Mutsafarian New England Journal paper, where they have a change and change analysis of changes in sugary beverage intake and weight gain. You find very similar effects of 100% juice, change in 100% juice on weight gain. It makes sense. What's the difference between apple juice and a fruit drink? There's not much if you just think in terms of the sugars involved. But you don't find that consistent evidence in children. There was a recent report that talks about this, but there's pretty limited evidence in young children of the relationship between juice intake and change in BMI, and I think it's limited by two things. One is the measurement limitations that we've talked about. If you have unreliable measurement, it's going to attenuate relationships. And again, it's really hard to measure intake in young children. And we don't have randomized trials that examine change in 100% juice and change in BMI in young children. And most of the studies are baseline studies predicting change, which again, I'll say doesn't make any sense. I'll talk about that in a minute. Is in the, in fact, I'll show you the next chart here. In the first study we published in The Lancet back in 2001, which helped to kick off the study of the relationship between sugary beverage intake and BMI and obesity in children, we found the result, which is basically the middle line there. Our dependent variable is change in BMI related to change in sugar-sweetened beverage intake. There we were looking at follow-up BMI controlling for baseline, which is basically a change analysis. We found that significant relationship, and we also found a relationship with incidence of obesity. In that same data set, we did the change in BMI in the line below there, the 0.16 of the coefficient. That's a fixed effects regression, which is pretty similar to the analysis above, and both of those are statistically significant. If we do an analysis where we say, let's not look at change predicting change, but rather let's look at just baseline BMI predicting change in BMI over time, we get a coefficient of 0.01, or no relationship. Now, why does this? Yeah, I know this is kind of a geeky thing, right? I'm just taking you through this methodologic world, but the reason that top one, what doesn't make any sense, is the following. Let's say we're doing a randomized trial like that Deuter study. What you would do is you would manipulate sugar-sweetened beverage intake and then look at whether that change in intake produced a change in BMI. But if you're looking at baseline predicting change, there's no manipulation. There's no change, so you wouldn't expect anything. And the other thing that goes on, particularly among humans, is that if someone has already gained excess weight, often you'll then change in response to that. That's the reason you want a double-blind study. So the next best thing we can do with longitudinal studies is look at change and change. And again, most of the studies that are done that look at children's juice intake have looked at baseline predicting change, and they don't find much. Big surprise, because you wouldn't have expected anything. In the Mutsafarian paper, the New England Journal paper based on 120,000 people, followed over 20 years, if you look at baseline predicting change, you'll see that sugary sweetened beverage intake is protective of gaining excess weight, which makes no sense. If you look at change in sugary beverage intake predicting change in BMI, you get the expected results. So that's kind of a long way of saying that what's been done right now with 100% juice analyses in young children, we just don't have the kind of data we need to make the inferences we need, and it's been misleading. It's found very small effects, and the reason is because it's flawed design, flawed analysis, and poor measurement. I think we should expect that 100% juice will produce the excess weight gains like sugary beverage consumption based on what we see with adults. And so I think we should revisit that as an area of study before we just assume that 100% juice is just fine. I mean, again, think of apple juice versus a fruit drink. I still have 2 minutes. So let me summarize that I think that we can potentially do a bunch to make environments healthier for kids. But where do children consume the most excess sugar sweetened beverages and 100% fruit juice? Well, it's at home. And how are we going to change those home environments? A lot of folks have mentioned, well, parents get confused. They see this fruit drinks, you know, and they think it's good for their kids. Or sports drinks, you know, my kid needs a sports drink because they're playing a sport. One way is to raise the price of those. And well, that makes a dent. It's an important intervention. It's spreading around the country. But one thing we need to do is to evaluate its impact on children. It's very clear that it's having an impact on what people are purchasing. The follow-up studies in Mexico, for example, show that people are buying less sugary beverages, particularly low-income populations. But it'll be really important to study the impact on children, and I hope that takes place. Thank you.